Elizabeth Ashborn, and I am at the World Bank, and at the moment the focal point on coordinating the activities of eHealth and mHealth for the anchor of the World Bank. In the last 4 months, we have been doing a review of what the World Bank is doing in eHealth and mHealth, and also including telemedicine, and trying to figure out sort of what the bank's position is in terms of financing of these resources at the country level. And we have discovered that we have, out of 149 active health projects, and that's health projects only, not including things like social protection or other public sector reform activities that would include health. Out of 149 active projects, we have about a third of them that have some component of eHealth, mHealth, or telemedicine. And this would include primarily the investments are in the area of health management information systems and health information systems, and an increasing number of activities related to health insurance. Our investments are global, absolutely global. They break down fairly consistently across regions, so that's in Africa, in Latin America, in Middle East, North Africa, and also in Europe and Central Asia. Our biggest projects to date are actually having to do with eHealth and mHealth investment within the context of bank programs, is in Kyrgyzstan and also in Egypt. One is a public sector is the health component within a public sector reform project, and another is, and the Egypt program is really on health insurance. But what I think our findings have been that whether you spend $200,000 or $20 million, that there is actually the possibility of having a fairly significant impact, not necessarily only depending on the amount of money that you're spending. The people are doing really creative things with technology. We have fingerprint analysis and identification programs. We have more traditional using software and hardware to do electronic patient medical records, and so on. So it's been very interesting. The other exciting part of this entire agenda, as it relates to World Bank projects, is that the drive and the momentum for including eHealth and mHealth as a critical part of World Bank programs is that it's really country-driven. That at the moment the bank does not have a global strategy, although the regions independently do have some components of a strategic framework. But on the whole, the interest and the opportunity of using technology for better health outcomes is actually being driven by our clients, and so we're working really hard to make sure that we can meet their interests, their needs, their demands, and to try and really use technology to its best advantage. The projects are all fairly they're sort of fledgling, they're new, although really bank investment, at least as far as we could find it in our study, really started around 2004. But in terms of doing sort of innovative activities within bank programs, there are many, but I would say that they're fairly new. So we've had some only limited evaluation of the activities that are going on. There has been a big health insurance program that's using technology to do patient monitoring and patient data collection, and then of course all sorts of components having to do with insurance, and that has undergone some preliminary evaluations. And I think that in Egypt, for example, a very large program, again sort of using the insurance industry and all of the data requirements of that industry to sort of test out how the implementation of an eHealth program might work more broadly in the health sector, not just in health insurance. But that's very new, and so there's not a lot of outcomes yet. There are some small projects in Kenya, for example, where they've used text messaging to alert patients to their need to take drugs or their need to be, adherent to their their treatment plans, and that has actually had some really outstanding effects, but at a very small community level. And so I think that that's true of the entire industry in general, and that's the industry of e-health and m-health. And there's enough activity now where I think we can call it an industry. That there are pilots everywhere. There are all sorts of interesting and innovative ways to use mobile phones, technologies, and so on, text messaging, or systems alerts, and sort of getting better health statistics from the data that's collected using the technology. But the sort of evidence that it's really is more cost efficient, that it's having a greater impact, that it's actually improving health outcomes is still, I think the jury is still out. I think that we are getting, part of the reason for doing this survey this last few months was to see sort of where we were, and then how can we leverage all of our activities and all of our resources to be able to sort of come up with some strategies that will be replicable and that do in fact demonstrate actual benefits to clients and to the countries. The World Bank have our two largest projects in e-health currently. One is in Kazakhstan and one is in Egypt. And the one in Kazakhstan is part of a much larger public sector reform program, and just the health component is approximately $78 million, and that is just at its beginning stages. And the project in Egypt is an equal amount, but focusing on health insurance as a way of sort of integrating e-health and all of the components and data requirements of health insurance, and using that potentially as a pilot for more full integration into the national health system in Egypt.